Well, it's very nice to meet all of you. I'm excited about the diversity of students that we have in here. We have some that are interested in health professions, athletic training, strength and conditioning. So it's always fun for me to see such a diversity of students. The next thing I want to ask you, and again, I think I can see that almost all of you have logged into the eLearn. I know, Marcus, we were still working on getting a password. Janae, I just got you added this morning, so you should be able to get in now to access any information. But, you know, kind of reviewing off of, assuming that you watched yesterday's lecture, tell me why anatomy is important for each of your careers. And if I was like super fancy, I would like you into groups so that you could discuss this. Do you think I could do that? Let's try it. Let's see how fancy I am. Okay, go to your breakout room and talk about why and what anatomy is and why does this shit matter in your life. Ready? Go.
Abstract certain teeth and what not to do within that. So
I think for like the healthcare field too, it's just like finding out, like we talked about like regional anatomy and stuff, and like finding out like if somebody has like abdominal pain, like being able to be like, okay, the whatever else is all there, you know what I mean? And like figuring out like what is causing the problem and then going from there. So
I agree. I mean, I'm going down the same track. So just knowing the structure of the human body and in detail is very important for our field.
You too.
So we don't. Oh.
Hi.
Hi. we were confused. We're like, do we hit leave room or is everybody just gonna join in on this?
I'll bring you back in a second.
Oh, okay, cool.
Let me go to this last one. Hi.
Hello.
Are you guys done?
Yeah. Yep. Yeah.
Okay. I'm closing the rooms. Here we go. Do we have everybody? 1, 2, 3, 4. I think we're still missing one of the groups yet. Here they come. All right, tell me what you talked about.
All right, so I talked about for athletic training, if someone's hurt or injured, you have to figure out if it's like the muscle or the joint or like where at it's hurt. And if you're like taping it, how are you going to tape it to help it?
Good. Let's hear from we got a nursing. Any nursing people?
I basically just said like it's important to know like the terms and stuff like that for nursing because like you know how you talked like it's universal terms. So
good. We have plenty of PTs out there. What do you think?
We just talked about how in order to like fully be able to help your patient to the fullest, you need to be able to like understand the anatomy of the body and understand what's really going on within the body.
Yeah, if we don't know how it functions normally, how can we fix somebody who's broken, right? OT, I had a couple OT. Yeah, 2.
We kind of said like the same thing as Sia did. Just kind of like we have to know the names and parts of the body to really understand what's going on and to help the patient.
Good. Let's see, who else? We got strength and conditioning.
I said that we need to know to understand like which body parts we're working on, or muscles that we're working on, as well as like the terms.
Yeah, definitely. Louise, PE?
To learn about like when you stretch, to learn about what injuries you're preventing, and then like when you go and like lift weights, what you're working on.
Good. Let's see, who else did I leave out? How about some med school, pre-dental, PA? You guys all fit in one category, I think.
We kind of talked about like regional like anatomy, like kind of what everybody else was talking about, but like it's important to know like if somebody is having a pain in a particular area, like what's there, and like knowing what's normal functioning and etc., just so you can diagnose the problem and take care of it.
Yeah, absolutely. So that's the one thing that I love about this class is like it applies to everyone. Like you guys all are going to need this as a basis for how you can do the next thing, whether that's, you know, tape and ink. You like my tattoo I have? I got a tattoo on my hand. It's a dog and a cat. We got matching ones, our family did, for Memorial Day. It's pretty exciting. So my 2-year-old also put one on his stomach. He thinks he's like addicted to tattoos now. Like we could have an issue here, but anyway, sidetrack. Again, this is kind of the basis for, you know, what's that next thing? How can I fix someone? How can I make someone stronger, right? So again, thinking about some of those factors, this is really that fundamental layer that we have to understand in order to do the next thing. So that's super exciting. I like that. So the next thing I want to talk about are the lab presentations. So I'm going to share my screen and pull up the outline that I have for that. Here we go. Can you see that? I'm confused. Okay, here we go. How do I make it big? Get out of my hair, people. Can you see this?
Yeah.
Okay. So the lab presentation, so each time we meet, either Monday, Wednesday, or Friday, we'll have 1 to 2 presentations, and they will go along with the lab material. And those presentations will be 15 to 20 minutes in duration. Again, I've kind of given you the topics for each of these. What I would do is use the lab homework as kind of a guide for what you should cover within that presentation. Okay. They're worth 40 points. You can do however you want to, really. The sky's the limit. Again, you guys are way more tech savvy than me. If you want to do a PowerPoint, you can share your screen and do it that way. If you want to just talk and that sort of thing, totally fine. So however you want to set that up in terms of covering the material that you need to cover. If you want me to go over any of this stuff before your presentation, I'm happy to do so. If you're like, oh, I'm not sure what to include or whatever, just let me know. I'm happy to go over any of that stuff. So what I want you to do now, so again, you can see all the topics here in the chat bar. Just put like your top 3 choices for what presentations you want to do, and I'll kind of fill people in, just kind of going through that chat in terms of when and what those presentations are. Again, those dates are set in stone, and so those presentations will be at 8:30 during the Zoom sessions. However, if you can't make it, that's no problem. Just get me a recorded version of your presentation prior to that Zoom session, and then I'll share it with the class at that particular time, or I'll post it on eLearn, or I'll do something. I don't know what it'll be, but something like that will happen. So, you know, if you know you got to work on Monday, June 1st, well, don't choose that particular topic if it's, you know, during this time or whatever. So just chat those to me and we'll kind of go from there. Other things to kind of include, let me scroll down a little here, within those presentations. So the first 2 are skeletal systems. So with the skeletal system presentations, you'll want to focus on the names of the bones and also the bony landmarks associated with each. So for example, turn here, see my skeleton guy over here. not only do you want to know what, you know, the sternum is, but also like what are these components? What are those, oh, sorry, you can't see that. What are these bony landmarks? Okay, so focus on the names of the bones and then also the bony landmarks for if you're doing either one of those two presentations. Let's see, what else? Plane of motion, anatomical terms, that should be super fun. That'll be a fun review for whoever chooses that topic. Let's see, shoulder girdle, shoulder joint, elbow, wrist, and hand. So with those, I would go straight to the lab handout and select the muscles that are listed on that lab handout, and then focus on, you know, what's the origin, insertion, action for each of those muscles. Are there any ways you could, or any tricks to like remember those or that sort of thing? So that's what I would do if you got one of those joints. Upper extremity muscle evaluation, this one you have to be pretty creative with, but maybe you choose some different actions. Maybe you choose throwing a baseball or something like that, or brushing your teeth or something like that, and talking about what's the joint action, what muscles am I activating, that sort of thing. Okay. Same with lower extremity muscle evaluation. So maybe I choose walking or running or doing a squat or something like that, and then looking at what muscles are activated, what are the joint movements, that sort of thing. You could look at, I know some of you've taken biomechanics, so you know you can look at the biomechanical actions and things like that. I'm horrible with biomechanics, so like whatever you would say in that, I'd be like, yeah, that sounds good, that sounds about right. So that's what's going on with that. Questions on these presentations? Again, they're fairly diverse in terms of you know, what I would be kind of looking for. Like I said, origin, insertion, actions, bony landmarks if you have one of the skeletal presentations, regional blood supply and nerve innervation. So again, that can be kind of universal for that particular region. So for example, in the shoulder joint, you have, you know, what are the nerves that run through there? What are the arteries that run through that particular area? Okay. You should also create some sort of handout or activity for the class, and you want to get me that in advance so that I can share that with your classmates prior to your presentation, if applicable. If you do the activity and you don't do a handout, that's totally fine. Just something so that we are studying. Because again, the thing with anatomy is just like a lot of repetition, honestly. A lot of it's not conceptually hard. It's just a matter of there's a lot to memorize. That's really what it is. So the more repetitions that we can have and the variety of ways in which we can kind of share that information, the better. Okay. Let's see. There's a grading rubric down here that kind of tells you how you'll be graded on that. Again, I'll give you feedback on those, you know, probably the same day that you do your presentation. So I'll try to get those done in the afternoon after our sessions are over. Any questions on the presentations at all? Everybody's good? Okay, so get out of there. Questions on, let's see, any questions on yesterday's lecture? Anything that you were like, oh, I don't really get that, or anything like that? Everybody felt okay? Okay. Okay. Let's see, other kind of housekeeping things, 2 other housekeeping things. Coloring book. Some of you have texted me or emailed me about the coloring book. If you don't have it yet, that's okay. Because I know the first thing is due like tomorrow. And there's pages in the coloring book that are due tomorrow. If you don't have it yet, just put a note in your homework that says, I ordered it, it'll be here on June 3rd or whatever, and that way I'll remember, and then you can just hand it in when you get it done, if that makes sense. So just still hand in the lab, just let me know that you're going to hand in those pages later or whatever, that's okay. Somebody also said that there's like a PDF version as well, so like if you had like an iPad or something and you wanted to do that, I would assume you could get that right away and do it that way. I'm kind of old-fashioned. I like things like written down, so I like the hard copy, but there is a PDF version as well, so you could do that if you wanted to. Everybody good on the coloring book? Yes. Okay. Now I have one other thing that I like, and I'm kind of dragging my feet on it because I'll tell you why. Because I'm getting a new computer today, and so I had to wait to download the updated software for it because it can't be transferred from computer to computer. I know that's like stupid, but so anyway, so I'm meeting with the rep this afternoon yet to figure out, I think I can get you a free version of this, but I want to show you this app. Again, it's not something that I require, but I think it is pretty helpful, and I'm actually pulling images and videos from the app for your exams, so probably even more helpful, I feel like, to have it. Regularly, I think it's like 25 bucks or something. You can get it on like your phone, your iPad, or your computer, but it's only like one download per purchase or whatever. But I think I can get a free version that'll be basically the same for you because of like COVID-19. They're offering like a free version, but I'm meeting with her this afternoon after I get my new computer and stuff to figure out if that version is good. So anyway, I'm gonna show you what's the deal with this app and why I like it. Here we go. So it's called Muscle Premium. It's listed on the syllabus. Again, I'm not requiring it, but I think it's super helpful. So here you can see, you can select, let me go back here. You can go to different views. So for example, let's say I want to look at the shoulder girdle, okay, because that's the lab that I'm working on. Again, I can click on different muscles and it'll tell me what the muscle is. You can also hide the other muscles so that you could just see that. You can also turn it around so you can see, you know, how it lines up with other things. But for like, I know for one of the quizzes I just got ready yesterday, I just kind of pulled some of these images and had this highlighted and then would be like, okay, identify this muscle, identify the motions with this muscle, etc., that sort of thing. You can also do actions as well. So you can go over to actions. Let's say I want to look at, let's look at shoulder extension. Okay, so it'll show me shoulder extension. Again, I can move the model so that I can see, you know, what's going on here. I can look at it from different views. Again, it's just a nice way to kind of get a visual on what's going on with those muscles. So, and then the last thing that I want to take a look at, there are quizzes in here. I don't have any quizzes set up or anything like that, but there are some self quizzes in here. You can also get like the origin, insertion, action out of here as well. I'm trying to remember, how do I do that? I'm not going to remember how to do that off the top of my head. Okay, so there's trapezius. Okay, so there we go. So you highlight the muscle and then you can click on this little book thing and it'll tell you the origin, insertion, innervation, and action. So wow, that's super handy for doing my lab homework. Also super handy if I'm doing this for my presentation. I could look and, oh, I already know what the innervation is. I already know what's that nerve associated with this particular muscle. So that's nice. Let's see, what do we do if we click on here? You can look at pathologies as well. So I believe one of the things in the lab presentations is you need to provide like one or, I can't remember off the top of my head, is it one or two common injuries or diseases that are impacted by this area. So again, if I had the skeletal system, maybe I want to talk about osteoporosis or stress fracture, something like that. But maybe if I have, you know, the shoulder joint, maybe I want to talk about rotator cuff injuries or something along those lines. So again, this gives you a bunch of different pathologies that you could choose from if you want to, based on, you know, this muscle or this region. So I think it's a super useful tool. Again, I'm going to try to see if I can't get you a free version of it that would be just as good. I don't know. We'll see how that goes this afternoon. I'll let you know right away for that. But yeah, any questions on this app? Again, you can pull these images off of here and put them in a presentation. Like I said, I've been pulling images off of here and putting them in your quizzes and tests as well. So that's where I'm getting quite a few of your images. So again, if you don't want to purchase it, that's okay. I just think it's a nice additional study tool. Maybe you do, you know, a quiz every day on, you choose something, right? So maybe I choose the shoulder girdle, and then I'm going to do, you know, the elbow joint tomorrow or whatever, right? So again, the idea with anatomy is just really repetition. You've got to do it a lot. You've got to continue to expose yourself to this in an active way. So again, just another tool for you if you think that might be helpful in terms of kind of visualizing things if you're more of a visual learner. Questions on that? Everybody's good? Okay. That's that off my list. Okay. 2 more things to do today. All right. So next thing I want to do is review the planes of motion from yesterday. And I'm going to get you guys up and moving. We're going to get out of our beds or out of our chairs or wherever we're at and practice some range of motion types of things associated with the different planes of motion. All right. So let's start with frontal plane of motion. Tell me what you know about the frontal plane.
It splits the body into anterior and posterior.
Okay, so it's going to split you into like a front half and a back half. Okay, what else do we know?
It's adduction and abduction.
So I tried to give you some like, this is like super weird, but this is the way I think about it. So like imagine that there's like a metal sheet or like a cardboard or something that's right it through the middle of me, and it's cutting me into a front half and a back half. So when we talk about movements associated with that plane, imagine any type of movement that will mirror that cardboard or whatever you're imagining, right? So it cannot cross the cardboard, okay? So again, if I have something that's cutting me into a front and a back half, stand up, back. So if I do something like this with my arms, right? That's not going to cross that particular barrier. Make sense? Okay. My computer up higher. I can go up to the podium like I'm like a real teacher. You still there? Yeah, you are. All right, so stand up and show me. Stand up, come on, get into it. Marcus, you got a video?
Still kind of new to this Zoom thing. I don't know exactly how to get my video to work.
Should be the lower left corner. It says it's on. Maybe you don't. Do you have a front video? Or are you on a?
Yeah, I'm on a MacBook right now.
Okay.
Kind of old.
I don't know what to tell you. I don't know. All right, show me shoulder abduction. We're just jumping right into it here. Yeah, Val. Yeah, Luis. Abduction. Okay. Show me shoulder adduction. Yep, we're going to add back towards the midline. Add back towards the body. Okay. Show me how you can move in the frontal plane with your legs. I know I'm asking you to get creative here. You got to move your cameras.
I'm not wearing pants. I'm not doing this.
All right, Luis, why don't you just watch somebody else then?
Yeah.
So again, remember that we've got to do the same motion as like what we did with our arms. Yep, Sia. Okay, so we've got it. So to do abduction, adduction of my legs. Okay, come out to the side and back in. What about your trunk? Can you do something in the frontal plane with your trunk? Or your core. So again, I can't cross that midline.
Lean side to side.
Yep. So lateral flexion, side to side. Yep. That's going to be frontal plane as well. Okay. That's pretty much it on frontal. Let's go to sagittal. Somebody tell me what sagittal is.
It's right and left.
Okay, so it
So
splits us.
it splits
Splits
your
us.
body.
Yep. Splits us into a right and left. Okay. So again, if you imagine that there is a piece of cardboard or whatever running straight down through somebody, splitting them into a left and a right. Again, what can I do to not cross that cardboard? Show me some things you can do. Yes, Jess? Yay, Jelani? I want to mirror that cardboard though. Okay, so this is not mirroring that cardboard. I want to mirror it and not cross it. Yep, Louise? Okay, so generally flexion and extension, okay? So show me shoulder flexion. What's shoulder flexion look like? Yep, shoulder extension. Shoulder extension is just like right by your side. I can also do shoulder hyperextension, which is kicking my arm back, getting that baton, because I'm a track person, okay? So those are flexion, extension, hyperextension, okay? What about your hips? Show me hip flexion. Yep, Jess? Yep, Taylor? Okay, so hip flexion can be either you bring your knee up, or I can bring my whole, I'm not very flexible, but I can keep my legs straight as well. That's also hip flexion, okay? Show me hip extension. Hip extension is just our regular position. I can also do hip hyperextension, which you can't quite see, which is kicking back further, okay? What about at my elbow? Show me elbow flexion. Yep, elbow extension. Yep, knee flexion. Knee flexion, let me see. Okay, knee extension. Yep. So in general, flexion is going to be a shortening of the joint angle, and then extension is going to be lengthening that joint angle. Okay. What about trunk? Can I do something in the sagittal plane with my trunk? Can I flex my trunk? Yes, Louise. So trunk flexion, I'm gonna get this figured out. Trunk flexion, this. Trunk extension, just upright. Trunk hyperextension is like kind of leaning back. So again, those are all sagittal movements as well. Okay, I think we got them all. Oh, finger, show me finger extension. Finger flexion. Yep, those count too. Neck flexion. Show me. Or cervical flexion would be the anatomical term. Cervical extension. And then cervical hyperextension. Good. All right, how about transverse plane? What do you know about transverse?
That's the same.
Oh, no, you can go ahead.
Oh, you're good.
It just divides your body into like your superior and inferior halves.
Yep, so it's gonna cut you into a top half and a bottom half. Again, any type of rotary motion, okay? So what type of rotary motion could I do at my cervical region or like with my neck?
Left
Yep,
and right.
Janae. Good. Okay, how about my shoulder? Can I do rotation in my shoulder? Okay, internal, external rotation can look like this. We can also do it like this as well. Okay. How about at my elbow? Can I do any type of rotary movement at my elbow? Nope, elbow's a hinge joint. It can only do this. Okay. We do have a radial ulnar joint, which will allow us to do pronation, supination. Okay. Show me pronation. Which one's pronation? Hands down. Yep. Supination. Cup of soup. If you want to hold a cup of soup, you got to have your palm up. Okay. So that's transverse plane. Okay. Hip. Show me something that you can do rotationally with your hip. I see a lot of trunk movement. So remember, when we think about our hip, you got to think about the relationship between your femur and your pelvic girdle. Okay, so this isn't activating that joint, that's activating my trunk, but I can do something like this, right? And you can put your hand like on the outside of your femur, and you should be able to feel your greater trochanter kind of slide, which is pretty cool. You can feel that moving. So show me external rotation of your hips. Yep, Alyssa? Yep. Okay, so external rotation, again, a lot of you are showing me this, which is correct, but also like you can do it like this as well. So just pointing my toes out. Somebody was in ballet out there. That's like 5th position, I think. Is that right, Lindsay? 5th position? Yeah? Okay, so 5th position is external rotation of your hips as well. Show me internal rotation of your hips. Yep. Good. So we can come across your body like a lot of you are coming in this way. Again, I could also do like pigeon-toed as well. And that's also going to be that internal rotation of my hips. Okay. Okay, show me some trunk rotation. Activate your transverse plane of motion on your trunk. Good. What's a strengthening exercise I could do to activate those muscles? My transverse plane of motion. How can I strengthen those?
Russian twist.
You got it. Russian twist would be great. Okay, good. All right. And now I have this is the only lab where I have a PowerPoint for it. But because it's our first lab, again, I want to just kind of do like an orientation with the body. So I'm going to, my plan is to get that pulled up here. Okay. Okay. So first things first, let's go over some of the joints of the body. The problem is now I can't see all of you when I have it like this. Glenohumeral joint, what am I talking about? What is it?
Shoulder.
Shoulder joint, very good. Elbow joint, you obviously know where that is. Radio ulnar joint, point to that. Show me. Yeah, it's like kind of in the middle here. Okay, again, that was what allowed us to do pronation, supination. Wrists, I don't think we have any issues with that. How about your lumbar spine? Where's that?
Lower back.
Yep, lower back. Hip, I think you probably know where your hip is. I think you know where your ankle and your knee are. How about cervical spine? Where's that?
Your neck.
Neck.
Neck, very good. Greater toe, I don't know why that made the cut for the list, but it did here. And then the last one, scapulothoracic joint. What do you know about that?
Your upper back.
Yeah, so it's like your shoulder blade. Turn my guy around here. That is my ability to move this blade. And that'll be our first unit that we go over for muscles. Planes of motion, again, we kind of went over these. So again, I hope you feel comfortable with those. I think also on the lab, I gave you a couple of little videos you can watch as well, if those are confusing to you. One thing to note as we kind of move forward that I think is helpful is making connections between which joints can move in which plane of motion, right? So again, the radial ulnar joint can only move in the transverse plane of motion. The scapulothoracic joint can only move in the frontal plane, okay? Let's see. The elbow joint can only move in the sagittal plane. So by thinking about which plane of motions they can move in, it helps us to kind of narrow down what potential actions each of those joints could have as well. Something like your shoulder or your hip, which are ball and socket joints, can move in all three planes of motion, which tells us that they have a great diversity of movement potential. Again, once we get to each of those units, we'll kind of talk about which joints move in which motions and that sort of thing. Directions and positions. Point to something that is superior to your sternum. I'm scrolling through all my images here. Good, yep, anything above your sternum, very good. Point to something that's inferior to your sternum. You got it, anything below that sternum, okay, very good. Point to something that's cranial to your sternum. We're sticking with sternum. Yep, cranial, closer to your head. Something that's more caudal to your, I'm gonna have to go with it, sternum. Staying with it. Yeah, caudal actually means closer to your tail, which we don't actually have tails, but you know, it's closer to like your sacrum, basically. Okay. Point to something that is posterior to your nose. Good. Yep. Good. Something anterior to your olecranon process. Ooh. Something anterior to that. Where's your olecranon process? You just chose your nose because you know that it's anterior to something. Olecranon process is your elbow. So something anterior to that maybe is like the front part of your elbow. Oh. Okay. Now I accidentally moved you people and now I'm like, Okay, there, that's how I want you. I know I'm talking to myself. All right, proximal and distal. So point to something that's proximal to your carpal bones, something more proximal than your carpal bones. Good. So what are the carpal bones? Where are they at? They're in your hand. Yep. So something closer to your point of attachment. And again, your shoulder and your hip are always going to be your points of attachment. So when we think about something that's proximal, it needs to be closer to your hip or your shoulder. Okay. Show me something distal to your elbow. If it's distal, think distance, it's going to be further away. Okay. So something distal has got to be further away to from your point of attachment. So something distal to your elbow has to be something from here down. Anything in that region. Okay. Oh, show me something medial to your elbow. Something medial to your elbow. I don't see a lot of people doing stuff on this one. All right, so again, here's my elbow. I can go on the medial side or closer to my midline, okay? My midline you can see because my belly button sticks out, okay? So something closer to that midline, okay? So anything from here to here work, okay? Something lateral to my elbow, or show me the lateral side of your elbow. Good. So remember, when we say something lateral, you got to get yourself in anatomical position. So your hands are facing forward, so the lateral side of your elbow is kind of on your thumb side then, okay? Superficial and deep, you won't be able to really show me, I don't think. Not that I can come up with in my mind, but superficial, again, is more external. Deep is going to be, you know, underneath, basically. General movements of the body. So again, we will apply these then to each joint that's appropriate as we move through each of the joints. But show me, let's see, show me flexion, show me cervical flexion. So again, a flexion is going to occur in the sagittal plane. Yep, head down. Okay. Show me cervical extension. Good. Show me cervical hyperextension. Yep, you got it. Okay. Show me trunk flexion. You're going to stand up again. Trunk flexion. Yep, Janae. Yeah, Jelani. Good. Yep, so you're hinging forward like you're going to reach down, touch your toes. Very good. Show me hip flexion again while you're up. Show me hip flexion, knee flexion. How about both? Yep, Val. Yep, Jess. Just scrolling through who I can see here. Yep, Alyssa. Okay, good. Let's see, can you show me hip hyperextension? Yep, Taylor. Yep, Alyssa. Okay, so again, you're kicking basically you're activating your butt. So you're kicking your leg behind you. Good. What plane of motion is flexion extension? Sagittal, thank you. Which joints can I do adduction at?
Frontal.
Yep, it's in the frontal plane. Which joints? There are 2 joints where I can do adduction.
Your shoulder.
Shoulder and
Hip.
and hip. Very good. Show me adduction, abduction of your shoulder and your hip at the same time. Yeah, jumping jack, people, do it. Yeah, crushing it. Yeah, get that workout in. Good, so that's frontal plane, very good. Okay, medial rotation. Okay, so 2 joints we can do medial rotation. What are those 2 joints? Medial rotation, which 2 joints can I do that?
Can you in your elbow? Or
No,
oh, okay.
The neck.
the neck can rotate, but that we'll call it like rotation to the left, rotation to the right, because you're already in the middle, if that makes sense.
Can your shoulder?
Yes, shoulder is 1.
Hip.
And hip, very good. So show me medial rotation of your shoulder. So yeah, so kind of 2 ways to show this, 2 different ways here. I shouldn't have came back to my seat. So I can go in like this, or I can come from here and go down, okay? Again, that's the same muscles if I go like this versus if I'm like in tight like this way, if that makes sense. That's medial rotation of my shoulder, even though it kind of seems like my elbow is moving if I do this, it's actually the shoulder joint that's moving. And again, you can put your hand, you can palpate kind of up here by your shoulder and feel that bone. If you don't have any muscle like me, you can feel that bone kind of rotating while you do that. Okay, good. And then medial and lateral rotation of our hips. Show me that. Good. Good. What plane of motion are we working with again? On this one?
Transverse.
Thank you. Very good. Okay, circumduction. What are we talking about? What's circumduction? Oh, I bet I could go right here. This is a good spot.
Is it like a circular motion?
Yep. What 2 joints could I do circumduction at? Maybe I'll give you 3 actually.
Shoulder?
Shoulder is 1. Yep. Show me shoulder circumduction. Yep. Again, the nice thing with a ball and socket joint is that's super smooth. Like it's smooth for us to do this. So someone like a swimmer, again, that's something they do all the time is circumduction motion. Okay. What other joint? I'll give you 2 more.
Probably the hip.
The hip? Yep. Let's see some hip circumduction. Oh, I see you're doing, a lot of us are doing some trunk things. Actually, when we do hip, it's probably going to look like this. Something like this. Again, when would we do this in the day? Think of any time? Not really a common motion for us. When might we do that? Of anything?
Soccer.
Okay, yeah, potentially. Yeah. A little bit, I know I'm in the swimmer's mindset here, but like a little bit if I were to do, gotta move it down. If I were to do something like this, swimming, or maybe I was a hurdler, pulling my trail leg through, getting some circumduction in that way. One other joint for circumduction that I'll give you. Yep. Ankles. Oh yeah, okay, I'll give you ankle and wrist both, I guess. Yeah. The difference I would say with your ankle and your wrist versus like your hip and your shoulder is that's not a true ball and socket. There's a bunch of different bones and shit in there, but like we can still get pretty darn close to that circular motion with our wrists, especially if you were to do something like dance or something like that where you could be doing those kind of fluid motions. We could do circumduction there. Okay, next to horizontal adduction, horizontal abduction. Okay, this can only occur in one joint, and I'll show you this one. Horizontal adduction is this. Horizontal abduction is this. Okay, so which joint am I activating?
Elbow.
Correct. So again, I can do this. You see my elbows are bent, like what I would do if I were to do a bench press or a push-up, but I can also have take my elbows out of it. Okay. So now this would be more like a pec fly or something like that if you're familiar with that term. Okay. So the way I remember this, adduction, horizontal adduction, a dreamy date, give them a hug. Okay, I had a good date, now I'm going to give that person a hug, a dreamy date, adduction. Horizontal abduction, a bad date, get them away, get them out of there. All right, a dreamy date, they get a hug, a bad date, get them away. Right? I know I'm cheesy, but like it works, right? You'll remember it now, promise. All right. Elevation. Hard without a person here to demonstrate for me, but elevation can only occur in one joint. Let's see if you can see elevation. Elevation. Which joint?
Shoulder.
It's actually the shoulder girdle. So again, when we think about what's going on, I'm sliding the girdle up. Elevation, depression. Elevation, depression. So what plane of motion is elevation and depression occurring in?
Frontal.
That's correct. Yep, everything in that shoulder girdle or that scapulothoracic joint is going to be frontal. Okay. Supination, show me supination. Yep, the only place it can occur is in your wrist. Yep, so supination, pronation. Oh, I'm a liar. We can also have a little bit of supination, pronation in your ankles, but look, we're not gonna get too crazy about that. Okay, supination, pronation, good. Plantar flexion. Yeah, Val. Plantar flexion, we're pointing our toes down. Yes, Jess. There we go. And dorsiflexion. Yep, pointing our toes up. Okay, so what plane of motion for those? So again, think about a calf raise.
Sagittal.
Correct, that's vaginal. Very good. And then inversion, eversion, again, this will be hard to see on y'all. But can you see my feet? No. Okay, inversion, eversion is like shifting your weight in versus shifting your weight out on your, it's considered an ankle movement. So again, where your weight is located. So like some people are more inverted than others. Like if you have a high arch versus flat-footed, has to do with that inversion process. Again, if I had something like plantar fasciitis, for example, and I went to an athletic trainer, I would be doing a lot of different stretches for inversion, eversion, and also some strengthening things for the muscles that would allow me to have that particular, arch setup. So, okay, lateral flexion, 2 places where this can happen. Can you think of them?
Shoulder.
Somebody said something, but I couldn't hear it.
Shoulder.
No, not shoulder.
Hip.
So this will occur in like in our trunk. So cervical and lumbar. Okay. We actually don't have much movement or mobility in our thoracic area. So like in the area with your rib cage. Anybody know why? I can do lots up here, and I can do a fair amount down here as well with lumbar area. Why can't I do much in my thoracic region?
You don't move your organs.
Yeah, the job is different there. Like you have like a heart and stuff and like lungs, and like if we had a lot of movement occurring there, we would puncture one of those. So again, that area is pretty stable. We have quite a bit of movement that's available in the cervical region and also in the lumbar region. Yep, very good. Okay. I'm not going to go through each of these, but again, I just have some images in here of each of those movements and which joints they can occur in. Again, this will be helpful for you when you do your lab homework. So you'll have this information right after class. But again, it kind of shows you each of those things. So let's check out like the vertebral column, the lumbar area, for example. Notice that we can move in the sagittal plane, we can move transversely, and we can move in the frontal plane. Okay, so again, 3 different planes of motion for both the lumbar region and the cervical region as well. Okay, scapula, again, this one was hard for me to kind of show you, but we have elevation and depression, which are 2 that I kind of demoed. We can also do adduction and abduction of the scapula. And so with adduction, again, think about like if you were to go to the gym and do like a bent over row or a seated row or something like that. How many of you work out? Just so I know when I'm making these references, if these are familiar to you. Quite a few of you. Okay. It's okay if you don't. I will explain what I mean. But like if I were to do like a seated row, for example, again, imagine that I'm the idea is I want to squeeze my shoulders together back. That squeezing of those shoulder blades in the back is adduction. Okay. Abduction, I'm pulling those shoulder blades apart. So maybe I need to reach forward for something that's a little bit out of my grasp. Okay, so that would be the opposite. That's abduction. And then upward rotation and downward rotation. The only time we really use these is if I'm trying to reach something that's like high on a shelf. So again, if I just reach straight up, I didn't activate or move this, but from here, if I reach a little higher so that I can get that item, my scapula is gonna kind of twist out to the side just a little bit, and that's what's kind of shown with this upward rotation, downward rotation. Now, one tricky thing, and again, we'll talk about this when we do the unit on the shoulder girdle, even though these say rotation, this is still, everything here is still frontal plane. Because those scapula, how they're located next to the thoracic cavity, they're just gonna slide up, down, in, out, side, side. So they're not having any, like, they're just moving, like they're just sliding. Does that make sense? Yeah? You're okay with that?
Yeah.
All right, shoulder, again, we went over these in a fair amount of detail. Again, we can move in all three planes of motion. Let's see, flexion extension was which plane of motion?
Sagittal.
Got it. And this one we didn't go over, but horizontal abduction, adduction, which plane of motion do you think this is in?
Transverse.
That's correct. Okay, so again, think about how I'm kind of rotating in order to have that motion occur. Very good. Okay. Elbow joint is a hinge joint, so we can only do two things. We can do flexion extension. The radial ulnar joint can only do two things. So only transverse for radial ulnar, only sagittal for elbow. Wrist, we can do all sorts of stuff. We can do a flexion extension, abduction, adduction, or sometimes also known as ulnar deviation, radial deviation. So with this one, I'm going to head towards, so again, get yourself in anatomical position. And abduction, again, I'm going away from the mid, abduction, I'm going away from the midline. So I'm going towards the radius, which is on the thumb side. So I'm like kicking my hands out like this. And adduction or ulnar deviation, I'm coming towards the midline or towards the ulna, which is on my pinky side. Okay. Oh, lots of stuff that your thumb and your finger can do. You OTs will just love that when we get to that for the wrist and hand section. That's right up your alley. Face, I don't really care that much about facial movements. We don't really spend a whole lot of time, but you can move your face, turns out, so that's good. So we can have different things happen like eating and talking, so that's nice. Pelvic tilt, again, I'll talk about this in great amount of detail when we get to the hip unit, and I'll be even bigger by then, so like you can really see some pelvic tilt going on. But again, when we think about pelvic position, kind of have this standard position, but we can also like kind of lean back a little bit, like if you have like some excess weight or something. But we could also kind of have this anterior tilt as well, which is kind of like leaning forward. Again, what that probably tells me if I have an anterior tilt is I have tight hip flexors here, which causes me to kind of have this hinge forward position. Okay? I can also do a lateral tilt as well, something like this, which might be great if I wanted to do something like shoot a layup or be a high jumper in track and field, something like that. So lots of different coordinated movements are going to rely on doing lateral tilts. But generally, when we think about anterior and posterior tilts, we're thinking about like a more stable position, if that makes sense. So like, what's your current status for pelvic position? And again, a lot of times it has to do with weight distribution and maybe tightness or weakness of certain muscles, which I think is super interesting. Again, hip can do all sorts of stuff. It can do everything that the shoulder joint can do, with the exception of it can't do that horizontal adduction, horizontal abduction, but otherwise it can do all the same things. A nice, strong ball and socket joint. Knee, I personally like to consider it a hinge joint, which is not what it is. Generally, it can do flexion and extension. It can also do a little bit of rotation. I don't think I have any wrestlers out there. No. That's one thing that I don't like about wrestling, and I love all sports, is they really like to get some rotation of their knees going, and I'm like, ugh, it makes me cringe a little bit. Because you can do a little bit of rotation, but it creeps me out a little bit. It's a good way to, like, you know, tear your MCL and stuff like that, but we'll talk about that later. A little bit of rotation, mostly flexion and extension. Again, we talked about inversion, eversion, how we could shift our weight to the inside of your foot versus the outside of your foot. Dorsiflexion, toes are up, plantar flexion, toes are down. You can also flex and extend your toes as well. All right. Questions on that kind of introductory information? So that should be helpful for you as you're working on your homework. Your first lab homework is due tomorrow at 11:30. There's a Dropbox for you on eLearn. I'll do my best. Well, I'm pretty sure I told you that I'm pregnant, and if you didn't already know, like, I think that was probably pretty obvious in the images or the video today. I'm gonna do, well, first of all, I'm gonna make it through all of summer school before these babies are born. That's my ultimate goal. But I'm gonna stay on top of I'll grade things every day. So I'll grade them tomorrow at 11:30 so that everything is done and caught up, just in case something happens and someone else has to take over this class. Everything will be caught up the best that I absolutely can. But we're gonna be positive that's not gonna happen. Everything's gonna be great. We're gonna make it all the way through July and life's gonna be good. All right. So that lab homework will be due tomorrow. Again, I gave you my cell phone number. Feel free to text me or call or email. I don't care. I go to bed at like 9 though. So if you're waiting till tonight to do it, it'll be like 6 tomorrow morning when I respond. You can still text me. That's okay. I don't care. But I go to bed super early. So there's that. Now, one question I have for the group. So I have like your quizzes and those exams set up to be right at 8:30 on Tuesdays and Thursdays. Does that work for people? Do you want a bigger like gap of time? What works for you guys? You tell me what's going on in your world.
So is it just open to, like, we have to take it at 8:30 so it's set up, you know, and you get, I think, like the hour or whatever time?
So each quiz will be 20 minutes and they're 20 questions. So you do need to actually like study. You won't have time to look everything up. And that'll be true with your exams as well. So you'll have a time limit on those. I'm working on uploading exam 1 right now, which isn't until, I don't remember what day it is. Next Friday, June 5th. And I have like 87 questions. So I'll probably give you like 90 minutes to do that. But again, my idea is, well, in real life, you wouldn't have your notes. So yes, I know you can have your notes, but you're not gonna have time to look every single question up. So all the quizzes will be 20 minutes, 20 questions.
For, sorry, I didn't know you were.
Yeah, go ahead.
Oh, okay, sorry. I was just wondering, for the quizzes, would there be any possibility, because I see that we have like an hour to take it, to like maybe have a bigger gap, like maybe if we could have like, it opens at 8 a.m. and we have until a certain time to take it?
Yeah, absolutely. Just tell me what works for you guys. I know you guys have other, a lot of you are also working or doing other, observation hours and things like that. So tell me what works for you. I'd like to get, I do want you to take it on Thursday if that's, just so we're staying on top of things, but I don't really care what the time is. I just was thinking maybe that would be good for like routine, but I'm happy to that's easy for me to change. You just let me know what's best for you.
Okay. Do you guys have any suggestions? I just threw it out there because sometimes my work schedule, they're like, we need you really early in the morning and random times. So
yeah, I work Monday or Tuesdays and Thursdays, 12-hour shifts, but I'm like I'm like at a desk, so for the most part, like I can, yeah, I don't know.
Yeah, I mean, I'm good with opening up at 8:30 or whatever. Probably make it last till like 1 or something.
Okay, 8:30 to 1. Does that work for people? Okay.
Next week, Thursday, I do have to go to the doctor, so like I don't know how long that'll be since I have to drive all the way to Iowa City.
Okay. So you want earlier?
I have to leave my house like 4 in the morning, so
that's way
in the
too
afternoon. If it could be like open in the afternoon, that would be good.
Okay. And that'll just be for this week though, you're saying, Jess?
Next week, Thursday, yeah.
Okay, so
like the 4th. Yeah.
Send me an email or whatever.
Okay.
So I don't forget.
Okay.
Okay, so generally 8:30 to 1 will work for people. Okay. So I'll open those up so you can take them anytime between then. And then all the answers will be released at 1 p.m. then. So when that closes, you'll be able to log back in and see I think you'll be able to see your score right away, but it won't give you like what you missed or your correct answers until 1. I think that's how that works.
Thank you.
Does that work for everybody?
Yeah.
Okay. Yeah, and again, if you have individual things, like I'm happy to modify, I have no problems modifying them. That's easy for me to do. So just communicate with me. I think that's really the key to success in this class, is just make sure you're communicating whatever you need, if you have questions and that sort of thing. All right. Questions about anything coming up? Okay, so I'm gonna get your presentations assigned to you, and then I'm going to email that out right here after class, because we'll have our first 2 presentations on Friday. So again, I haven't looked in the chat to see if anybody volunteered for those, but I will put people, I'll just kind of go through the list and do my best that way for those presentations. All right, so I'll email that out to you right away here after class. UD and Clark people, using your UD and Clark email, works best for you? Okay.
Yeah.
Okay, all right. That's what I got from the registrar, so I figured that would be the best way to get in contact with you. Otherwise, anything else? Any other questions for you guys?
Yeah, for the lab, are there any like questions like specifically for like certain bones on our lecture quiz, or is it just what's on like the handout for the lecture 1? If that makes sense.
Are you asking for the quiz tomorrow?
Yeah, like is it like going to be like the stuff we over in lab today, like the specific parts, or is it just like the lecture 1 handout, like the overview? We didn't go into like certain specific.
It's on lecture 1 and lecture 2. So there's some stuff from the skeletal system, like on, the
osteoporosis and all that.
Yep, you got it. And then stuff from yesterday, so plane of motion. There might be one about like, the different branches of anatomy, that sort of thing. Yep, so focus on the lecture material from yesterday and today for that.
And then on YouTube, I think lecture 2 got switched with lecture 3, or like, okay, I didn't know if I was doing them wrong or what is going on.
Well, here's the honest truth. So usually I go to the ACSM conference, which was supposed to be this week, and so I had those audio lectures recorded from previous years, and so that's why the labels are wrong. But just do the skeletal lecture today, and then do the tissues tomorrow.
Okay.
And then with the coloring book, you might have gone over this, but to turn in like our homework for the coloring books, like are you expecting for that?
Just take a picture with your phone and submit it that way.
Oh, okay.
It's just like a way to study. I'm not going to be like spending like an hour going through and being like, oh, Taylor got outside of the lines. Oh, 9 out of 10 or anything like that. Like, it's just a way for you to study. And I just want to verify that you're, doing those things to have repetition. Yeah. Anything else? Yeah.
I just had one quick question. Sorry.
Yeah.
I was wondering, are you going to upload the Zoom recordings onto eLearn or?
Yes. So they take me, well, I'm at school now, and so I can do it faster here. If I try to do it from home, it takes me probably an hour or so to upload it.
Okay.
But I will do that on the same day. And I plan to come to school on all of our Zoom days so that I can upload those faster. So we'll get those uploaded as soon as I can right after class. So, yep.
Okay, thank you.
Yep. Anything else? Anybody? Okay, so I'll plan to send out, later today, I'll send out your presentation topics. Tomorrow you'll get another Zoom request for me for Friday's meeting. And that's it, I think. Just make sure you're following along with the course calendar, and just let me know if you have questions as you're working on stuff.
Okay.
All right. Okay, peeps, have a great day, and I will see you on Friday.
Thank you.
Thank you.